Our clinical trial that I was fortunate enough to present was a randomized trial between BRAF and MEK inhibitors versus our standard treatment approach for patients that have clinical stage 3 or oligometastatic stage 4 melanoma with a BRAF mutation. And so what we were trying to do was to see if we could improve outcomes, specifically relapse-free survival outcomes, for patients that got the neoadjuvant Dabrafenib and Trametinib therapy versus our standard approach, which is surgery up front and then adjuvant therapy. And what we showed with this trial was that there was a very highly statistically significant improvement in relapse-free survival for the patients that got the targeted therapies compared to the standard treatment approach. And because of this, this led to early closure of this clinical trial after just a quarter of the planned patients were enrolled into the trial. And so what we've been doing is analyzing. On this trial, we were able to get blood and tumor samples across the treatment time frame for the patients that received the neoadjuvant therapy. And we've been analyzing those to try to understand the predictors of response and resistance. We've also been analyzing this concept called pathologic complete response, which means that basically, because of the therapy that's been administered, patients' tumors die completely at the time of surgery. So there's no viable or active melanoma at the time of the surgery. That's what's called a pathologic complete response. We think that those patients that have achieved a pathologic complete response due to the therapy do much better than patients that did not have a pathologic complete response or that had the standard of care treatment options. So based on these limited data, but very provocative results, we are further changing this trial to specifically explore only the neoadjuvant therapy. We'll continue to enroll patients just for the neoadjuvant therapy, try to understand who's going to achieve a pathologic complete response, why do they have a path CR, and does that correlate with improved relapse-free survival and overall survival.